Well, good afternoon, everyone. Jim Brett of the New England Council. And let me thank all of you for choosing to start your week with the New England Council. You obviously have great taste, and we thank you for your support. These Zoom calls have been very, very well received, and today is no exception. Today, we're very thrilled to have Congresswoman Annie Kuster, who many of you know is serving her 4th term, representing the 2nd Congressional District in New Hampshire. She's just been a terrific advocate for the New England delegation, for New England, for our nation. She's accessible, she's approachable, she's always looking for opportunities to learn about new issues, and I know that our members appreciate her advocacy. She also serves on a committee that's very, very important to New England Council members, Energy and Commerce Committee, that obviously is involved in energy and health, but also climate change, as well as interstate and foreign commerce. She also has a responsibility by being a member of the Health Committee, subcommittee, which has jurisdiction over health technology, insurance issues, medical research. So she has an awful lot on her plate. And she is the, I believe, the founding member of the opioid task force that began many years ago with a former colleague who's also on the Zoom today, and that's Frank Gunter, who also served in that position as the co-chair too. But she has really spent an awful lot of time on this issue, and she has developed a relationship with the co-chair, Brian Fitzpatrick from Pennsylvania. They put together a 2020 agenda on the opioid task force recommendations, and hopefully she'll get into some of that today. But before I turn it over to the Congresswoman, one quick housekeeping note. We're taking live questions today. So if any point you would like to weigh in and have a question asked and have the Congresswoman answer it, feel free to look at the Q&A function in the Zoom window to type in your question. Sean Malone, who is the policy director of our committee here, will be helping us to facilitate the Q&A portion of the program. So with that, again, I just want to thank the Congresswoman again, not only for today, but always being available to the members of the New England Council. So I thank you. And I turn it over to my good friend, Annie Kuster.
Great to be with you, Jim Brett, and thank you for the kind introduction, and thank you to the New England Council for organizing this important discussion. So as you all know, in New Hampshire and communities across this country, we are battling this opioid, this epidemic within a pandemic, and that's the opioid epidemic within the COVID-19 pandemic. And while our focus is justifiably on COVID-19 and how to best mitigate the spread of the coronavirus, we cannot make progress. We cannot undo the progress that we've made on the opioid epidemic. So I appreciate the opportunity to get into this with you today. In 2015, I founded the Bipartisan Opioid Task Force with my former colleague, Congressman Frank Ginta. And as Jim mentioned, Frank, welcome to the call. Delighted to have you with us. And since then, I have been co-chair and led the charge in Congress to find solutions to this devastating problem that can save and turn the tide on the epidemic. So last Congress, the task force helped pass 36 bipartisan bills to help address staffing shortages in substance abuse facilities, treatment facilities, enhance best practices for recovering housing, better trained pharmacists on patient overprescription, and combat the expansion of synthetic opioids like fentanyl. While the passage of comprehensive opioid legislation last Congress, and that was known as H.R. 6, was an important step, there's so much more that can be done, and we are continuing to work on the issues. So that's why in February of this year, we released our 2020 Bipartisan Opioid Task Force Legislative Agenda, and you can see a copy of that and download it on my website, kuster.house.gov. This agenda, the 2020 agenda, and we've done this every term of Congress, outlines 27 bills. All are bipartisan bills. Our task force now has about 80 members, and the high water point last session, we were up to about 105 members, but we lost a few of those Republicans in the 2018 election. It's roughly even, although there are probably a few more Democrats at this point. But our only rules of the road is that the bills have to be bipartisan to make it onto our agenda. And then that agenda serves as a blueprint for colleagues on energy and commerce and on other committees around the House. So we are addressing substance misuse through improvements in prevention, treatment, long-term recovery, also rural communities. Workforce development is a big issue for us. Law enforcement and criminal justice reform, obviously big issues for us. Children and families, and finally veterans. Two of my game changer bills included in the agenda have garnered bipartisan support this year, and I want to just go through these in a little bit of detail. The first is, we call it the Create Opportunities Act, and it creates a new grant program administered by the Department of Justice to fund medication-assisted treatment, known as MAT programs, in state, county, and municipal jails and prisons. Studies have demonstrated that up to 80% of patients treated with MAT disengage from criminal activity. So that is a significant finding, and this is probably the biggest thing that I've worked on in Congress. This comes out of work here in New Hampshire and extraordinary results. To step back, what we have is a public health crisis, and we have mistakenly treated it as a criminal justice crisis. It's not to say that there isn't crime and we need to crack down on that, but many, if not most of the people in our state jails and prisons have co-occurring mental health and substance misuse issues. I'll tell you about a visit up to the New Hampshire women's prison right before COVID this winter, when I learned from the superintendent there, 100% of the women in the New Hampshire women's prison are survivors of sexual assault, domestic violence, or abuse and neglect in their childhood. And so it's quite extraordinary. So it's really important to understand that 80% of patients treated with MAT disengage from criminal activity. They have a health crisis. Secondly, and this takes it the next step, I've introduced the Humane Correctional Healthcare Act. So this is a bipartisan bill in the House, and Senator Cory Booker has the companion legislation in the Senate. And what it would do is repeal the Medicaid inmate exclusion, which is an archaic prohibition of federal funds paying for inmates' health care. If you go back 50 years ago when Medicaid was first created, and I think probably they were trying to save money, or they thought that healthcare for inmates would be treated in infirmaries within the jail or prison, they excluded the use of federal funds to pay for inmates' health care. And as a result, for 50 years across this country, we've had people with mental health, substance use problems. They do not get adequate treatment. And then we all act shocked when they come out and go back to their addiction. And so we are solving for the wrong problem. It's extremely costly for our economy and our federal budget. And these are precious tax dollars and frankly, precious lives that are being wasted. So the result of the Medicaid inmate exclusion is that states and counties must cover the costs, which they can ill afford. And my bill will help ensure treatment for substance use disorder and mental illness, and improve prison and jail health systems across the country by providing Medicaid and its standard of care to those who are incarcerated. This is a very heavy lift, but honestly, I think game-changing legislation. If you look at the issues that we're addressing now in the George Floyd Policing Act, we lost an entire generation of African Americans to our prison system, when really what it was about was addiction and substance use issues of crack cocaine or methamphetamine. And now here in New Hampshire, we've seen this in the white population, people being locked up in prison when what they really need is substance use treatment. So I'm very pleased that this legislation was recently included in an Energy and Commerce legislative hearing. And the HEROES Act, passed out of the House, which is now pending in the Senate, includes a study on the repeal of the Medicaid inmate exclusion. It also includes my colleague Paul Tonko's bill to start MAT 30 days before release. There's so many more people that are getting medically assisted treatment, and some of the litigation has come out of Massachusetts. It's just barbaric if somebody's on that kind of treatment to take it away from them if they get caught up with the law and end up being incarcerated. So we also want to try this experimentally to provide it before discharge so that people can have what we call a warm handoff to services in the community. The HEROES Act also includes my legislation to create a direct emergency grant pathway to community-based organizations that provide substance use disorder services. And while so many providers have experienced dire financial consequences as a result of COVID, smaller entities depend on these grants and state funding that are all too often the first to be cut when budgets are strained. As a member of the House Energy and Commerce Committee, I'm pleased to be on the front lines of advancing critical health legislation. We're committed to improving access to affordable, quality health care, and we're committed to the equitable distribution of quality health care. This is more important every day as we face the greatest public health crisis of our generation. Tomorrow, our committee is holding a hearing on the pathway to a vaccine and efforts to develop a safe, effective, and accessible COVID-19 vaccine. And I'm eager to hear from the manufacturers, including Moderna right there in Cambridge, Massachusetts, who are part of Operation Warp Speed as to developments on a safe and effective vaccine. My legislation is called the Coronavirus Vaccine Development Act. It's HR 7104. And it requires BARDA to enter into public-private partnerships to expand and enhance vaccine manufacturing capacity, while also requiring the administration to develop a plan to ensure adequate supplies for administering the vaccine to everyone in our country. This is essential so we can assure that all Americans have equitable access to the vaccine. And by this, I mean communities of color, rural communities, elderly Americans, and our young people, everyone, when one is available so that our communities can reopen fully and successfully. And while much of the news has been dire, we can't ignore the positive role of telehealth that's come out of our COVID-19 experience and help to maintain access of care for those who need it. You know, I've heard from both providers and patients around the state of New Hampshire and in my district who are actually grateful for the flexibilities allowed during COVID to allow for greater use of telehealth. And in fact, one issue in particular, there's a streamlining and a greater efficiency because we have fewer missed appointments with telehealth. So as we look ahead, we need to continue to modernize our healthcare delivery. And I want to make sure we continue the reimbursement for telemedicine. The potential of telehealth cannot be realized without investing in broadband connectivity for our communities, large and small, urban and rural. That's also an issue for us here in New Hampshire. Even during the public health and economic crises that we've been facing over the past 4 months, we still need to work on protecting and building upon the advances of the Affordable Care Act. So this month, the House passed the Patient Protection and Affordable Care Enhancement Act, which expands affordable quality healthcare to those in need. And we cannot allow partisan politics to govern the well-being, health, and financial security of the American people. So I'm proud of our work in energy and commerce, and I look forward to talking with you today and answering your questions about issues that are on your mind. Thanks, Jim. Thanks for having me.
Great, thank you. Just talk about your state and how, on the ground, how bad is it with the, with the pandemic, with the addiction, opioid? I mean, are we
Sure.
seeing a spike? Oh, it's leveling off, or is it on a decrease?
Yeah, sure. So let me first start with COVID. And I want to say this, I always have to knock on wood here and say this with all due humility, because in fact, New Hampshire is doing extraordinarily well. I think Maine, New Hampshire, and Vermont, maybe Rhode Island are among the lowest rates in the entire country right now. New Hampshire, for the past, it's almost 3 or 4 weeks, it goes back before the 4th of July, we've been averaging right around 20 to 25 cases per day. Our statewide population is 1.3 million people, so that's quite extraordinary. And we have stayed very, very steady at between 22 and 24 people hospitalized for COVID. We were following these numbers very, very closely the last 2 weeks because 4th of July was so crowded, so busy up here. There is not an empty bed in the Lakes region of New Hampshire, I can tell you that. A lot of people from the Boston area have come up. Many moved up here in March to second homes in the Lakes region and the White Mountains. Luckily, they've been good citizens. They wear their masks when they go out. They keep their distance. And because the weather's been so glorious and everybody's been playing outdoors, that makes an enormous difference. I think it's about a 20 time differential of your chances of catching COVID. It's much, much worse indoors. So we're in a good place with COVID. We were not, this has been a long haul. I put out a roadmap to recovery back in March, April timeframe. And we went through a really tough time, as did all of you, obviously, in the Boston area. The southern part of my district, Nashua, Salem, that's really an extension of the Boston, kind of economy and certainly market. And so we were hit quite hard there. Manchester had a tough time. Some of the towns in Rockingham County over in Chris Pappas' district. But we really stuck to the testing, the tracing. We've had 100% contact tracing, which is just extraordinary, and the isolation of people. So with the epidemic within the pandemic, which is the opioid crisis, we did have an increase in opioid deaths, which is tragic. We had some major challenges. I want to give a shout out to our treatment providers. We had major challenges trying to get people to transition. If you think about AA, NA, Narcotics Anonymous, trying to do all of that online through Zoom calls and et cetera. It was very challenging for recovery housing and inpatient treatment facilities. But I think the silver lining is this telehealth aspect, because for some people in my district where transportation and childcare and all of these other issues were barriers to treatment and recovery, now they're able to access the mental health and the substance use treatment that they need, as long as we can get them the technology and make sure they have the broadband resources to get the help they need. So it's an ongoing challenge.
Right. In recent months, there's been a significant focus on reopening the economy. I think it's safe to say that the state of New Hampshire has done very well in reopening the economy. I think the Commonwealth of Massachusetts and many of the New England states. But what would you like to see in place before you would think it is safe to reopen the economy that we don't already have?
Well, I mean, certainly the holy grail here is the vaccine, and that's where I'm pouring my energies into making sure that we have the resources and the manufacturing, the supplies for the distribution of the vaccine. Our biggest battle, frankly, working with our governor, we have an all Democratic delegation working with a Republican governor, but we worked very well together behind the scenes. But he was frantic trying to get PPE, trying to get testing supplies. So I don't want that to happen again with the vaccine. Right. In the short term, having ubiquitous testing is critical. And making sure that if we do have another outbreak, we know about it right away. Excuse me.
Mhm.
And it's just allergies, I promise. That we know about it right away, that we get on top of it with the contact tracing, that we can isolate people. That's really, there's no secret here. That's the way to do it. You know,
Mm.
one thing I want to say, Jim, because this is a shout out to your members, we have been very, very focused. I think in New Hampshire, we hit our high watermark with 16% unemployment. Our hospitality and tourism and small business is what was hit the hardest. We had a 90% drop. And luckily, we were able to bring these numbers down by the first week in July so that, you know, the tourism that's so critical to our economy can have a couple of healthy months and rebound over the summer. But we don't often tell the story of the 84% of the people that kept working. And it's just extraordinary. I talked to Fidelity. They have about close to 6,000 jobs in New Hampshire and, you know, tens of thousands of jobs around the country. They had 98% of their company working online within 48 hours back in March. BAE had half the people working from home, half the people doing staggered shifts in manufacturing. Anthem, Liberty Mutual, you know, these are big, big employers, and they've done an extraordinary job. So obviously, we were focused in the CARES Act and now in the HEROES Act to make sure that the people that could not work safely or were furloughed would keep their wits about them and keep a roof over their head with the stimulus payments, the unemployment, the small business. The PPP was a big, big success here in New Hampshire, about 23,000 companies. So it's all coming together, and, you know, but still, fingers crossed, right?
Right. You know, for months, the CDC has been responsible for collecting and tracking the data related to COVID-19 pandemic. And I think they included the data on hospitalizations and deaths, but now it's been shifted. The White House has said we're going to shift that from CDC to Health and Human Services. Your thoughts on that move?
Totally outrageous. Honestly, I'm at a loss for words, which is rare for me, when it comes to the outrage coming out of this administration day after day after day. Most of them are just distractions to keep us from having our wits about us and, you know, focusing. But this one put me right over the edge. This is a autocratic, authoritarian. To try to keep the truth from the American people is completely outrageous. And I honestly, a shout out to journalism, the New York Times, the Washington Post, God help them that they can keep collecting the data from the counties, because this president does not want the American people to know the truth. He was on television again over the weekend, just lying, blatantly lying about, he's talking about our economy's bounced back. And, you know, there are parts of this country that are just devastated right now. I talked to a colleague, a member of Congress the other day in Palm Beach, Florida, where they have 15,000 new cases a day. She doesn't dare leave her apartment. She hasn't left her apartment in 10 days. What kind of a foreign threat would you need to come into your community and keep members of Congress locked in their apartment? And he's getting on television telling everybody it's fine. That was a low blow.
You know, some people have suggested that if we're going to reopen the economy, we need universal testing, and it needs to be available. Do you agree with that? And realistically, how far are we from universal testing?
Well, you know, this is another one of those questions. 30 days ago, I would have thought we were in better shape. But with this outbreak across the Sun Belt, they're having the exact same problems that we had 3 months ago. You know, they can't get access. It's the supplies. It's, you know, part of it is the testing and part of it is the supplies to administer the testing. You know, the last trip I took, I told you I've been 7 times back and forth to DC. And when I flew back the last time, it was very crowded. And my husband was very nervous picking me up. So I promised him, I said, we'll go get tested. It was right before 4th of July. We were going to see family. It took 8 days to get the test results back. Like that's not really going to work for the contact tracing. Now, to give them some credit, if we had been positive, I'm sure they would have been all over it. But in order for the economy to fully reopen, there's certain people, look at the schools, look at the teachers, look at, the kinds of positions where you have a lot of contact. We're going to need to know on a regular basis where the outbreaks are. But hopefully everybody will get to the place where we are now, where it's so low. If you, keep your distance, wear your mask when you're together, if you're in a grocery store or whatever, getting gas, that I think we can keep people safe. And this example of the 4th of July, I think is quite extraordinary because it was very, very crowded up here. And we have seen no appreciable increase in positive cases.
One often overlooked element of this pandemic is the toll the virus has taken on the mental health of individuals. And it's needless to say, it's been a very difficult time for everyone involved. But one could make an argument it's been particularly hard on those who suffer from mental health illness and addiction. Can you outline any additional responses you'd like to see from whether the state or the federal government for people who are suffering this addiction and mental health illness? Because I think this is going to be an issue that when we do find the virus cure, we're going to see a spike on domestic abuse, sexual abuse, child abuse, mental abuse, emotional abuse, loneliness, isolation. And I don't know if we're ready for that. And I don't know if people in Congress have been discussing, we need to put some significant investment in this mental health area because this is going to explode in the months to come.
I couldn't agree with you more, Jim. And I want to give a shout out to my colleague, Joe Kennedy, last week in the Energy and Commerce Committee. And we had a hearing with his cousin, Patrick Kennedy, who of course was a leader in this area. But we just advanced critical mental health legislation just last week. And it's about supporting peer-to-peer counseling for first responders. That's a critical piece. Our first responders are so stressed out by this. Actually achieving mental health parity, that's been a fight that's gone on for a long, long time, but one that's critical. And permanently allowing us to include a patient's home as an eligible originating site for mental health services delivered by telehealth. And that's where I've been very, very focused. And I want to tell you, quick story, we've been talking with practitioners who have been doing the telehealth. And this keeps coming up from psychiatrists, from mental health providers, from substance use treatment providers. They'll reach out by telehealth for an appointment. And the person will inevitably say, oh, I forgot I had my appointment today. Thank you for reaching out. And then they go ahead and have a successful appointment. Pre-COVID, that would have been a missed appointment. An incredible inefficiency in the mental health provider's day and an incredible frustration and lack of receiving services in the patient's day. So I think we've got to learn from this and take the best from it. And you do see examples of people, up on the lake this weekend, families spending time together. You do see some people managing through this in a way that is really drawing on their strengths, their mental health strengths, to get outdoors and movement and making a plan and being mindful about what brings you joy. Huge increase in retail and gardening and home goods and home improvements, putting in a patio, enjoying the time together. But I'm very concerned, as you pointed out, we've seen some really shocking statistics already about youth, about increase in depression, loneliness, as you mentioned. And then I'm very frightened. I also have a bipartisan task force to end sexual violence. And we had a just hair-raising webinar, you know, on Zoom with people who are expert in sexual assault, sexual abuse, pornography. What's going on behind these screens is just frightening. And we don't know, we don't have an eye on these kids.
Right.
And that's why, although it's challenging going back to school, we got to make sure the staff and the teachers and the students are safe. But I am a proponent of trying to get back to school so that we can get eyes on these kids, social workers and teachers, so we'll know, you know, what's going on. It's not safe for everybody being at home. If your predator is your relative and you're stuck at home with them, that is not a good situation.
I agree. Yeah. You know, all the scientists and medical professionals have all weighed in saying that wearing a mask is a key to preventing the spread of this virus. And yet there are some states that say we don't believe it should be mandatory. You know, it's up to the individual whether they want to wear the mask. We don't want to, you know, force it on anyone. If you had your way, would you be in favor of having a mandatory national mask mandate?
Well, here's the thing. We're just lacking the leadership at the top. We wouldn't even need the mandate if the president of the United States would wear the damn mask. I mean, you know, you lead by example. Look at Dr. Fauci. You don't see him without the mask. I mean, lead by example. And look, I'll tell you, here in New Hampshire, the masks work. And, you know, our governor, one of the reasons I think the president didn't come to New Hampshire is our governor said, I will meet him in a mask, but I will not go to that rally. It's not safe. And we've got to, there's several things. Being outdoors is critical. Keeping the distance is critical. The distance, the 6 feet. If you don't want a mask, then don't go near anybody. But when you cannot keep the 6 feet, you have got to wear the mask because you are just going to spread it. And so I think, you know, clarity from our leaders, and it was confusing at the beginning. They didn't want us all to rush out and get masks that were needed by healthcare professionals.
Right.
But guess what? As soon as they told us to wear the masks, everybody started sewing them. Like they misunderstood our ingenuity. And now there's plenty of masks available, and we tell them, I hate to tell you the expression up here, we say, don't be a mask hole. Wear the mask.
Yeah. Speaking of the virus, is Congress been meeting and discussing ways of being prepared if we do have another spike in the fall that people are in the medical community are discussing more frequently now? Will we be able to have, you know, the equipment? Will the ventilators, is everything, hopefully we've learned an awful lot in the last 5 months, but if we do have another spike, are we going to be ready? Are we going to hear horror stories again? The supply chain is broken down. We're not getting the, you know, the mask and the gowns that we thought we'd get. I guess what I'm saying is, are we ready for a second round?
Well, this may not be a sufficient answer. The House is ready. We passed 2 months ago the HEROES Act, and it has funding for the testing, the tracing. It has funding for the PPE. It takes this COVID healthcare crisis seriously and the planning. But we have such a lack of leadership. We don't even to this day have a national testing plan. We don't have a national plan for the vaccine. We, you know, I mean, this is our great frustration. And we will know in the next couple of weeks whether the Republicans in the US Senate are going to stand up and protect the American people in spite of the President of the United States. I think they will, Jim. I have faith, and you've started to see people peeling away from him, saying, you know what, this is real. People are dying in my district, and there's something about this going across the Sun Belt Florida, Texas, Arizona. That's a lot of Republican senators across the Sun Belt in this country. And they have got to be waking up to the music that this is real and that people are dying on their watch, and that we have got to step up our response. And we're just lacking in cohesion and leadership with a president that at this point does not even seem to care. And so, and you know what, let me end on a positive note. The business community has gotten the message. And last week when Walmart, followed by Target, followed by CVS, said, you need to wear a mask to come in our store. You don't have to come in our store. You have your freedom to stay out of our store. But if you want to come in our store, you wear a shirt, you wear shoes, you wear a mask. And that's it. It's that simple.
Just skipping to the political season. If Joe Biden were to be elected in November, what would the top healthcare related priorities be in the House?
Well, obviously, number one is COVID. And I've had so many conversations in the last couple of weeks. We're on a two-pronged strategy. We are moving ahead with the HEROES Act, with the bills in our committee, with working with the people in this administration, that with Dr. Fauci and Dr. Redfield at CTC. But there's a whole nother track, and that is putting together the response in the Biden administration so that we hit the ground running in January, and all of the mistakes that have been made by the Trump administration can be righted as quickly as possible, which is challenging. And I said this on a call the other day with some of the vaccine manufacturers. You better have a two-pronged plan here. And when we get to January, let's do the right thing. So I think that's number one. I think number two for me is obviously to make sure we continue to work on these mental health issues, the substance use, the opioid epidemic, and that includes the criminal justice reform and really tackling the fact that what we've had is a public health crisis with addiction, with mental health, with trauma, and that if we solve for the correct problem, we will have far fewer people in prison, far fewer problems with our police, and better racial relationships, and things would be better for our country, for everyone, for Black Americans, for Latinos. They're being disproportionately impacted. And then I think this telehealth issue is something I really want to stick with, because I think it's not a panacea, but there is a silver lining there for people who find it to be overwhelming, and particularly in mental health. My nephew is, he's in his 50s now, but suffers from schizophrenia, and it's very challenging for him to cope in the world. It's difficult to be out and about in the world. He's been very fortunate. He lives in a very small town where he can manage and he can see and get the psychiatric help that he needs. But for people who don't have that situation, but could get through telehealth the treatment that they need, without worrying about remembering appointments or getting the transportation or taking the time off from work. So many people can't take a half a day to drive an hour either way. So let's try to get healthcare delivered to every American, including mental health care. It's so important.
And then finally, what are you hearing on Congressman John Lewis's funeral arrangements? Will he lie in state in the Capitol? Some people like that. Others say because of COVID-19, really, it's not realistic to have something inside the Capitol. We might think of doing something outside the Capitol. What are you hearing?
I don't have the latest word yet on this morning. I think all of these ideas are being discussed. I think for most of us, for many of us, I was just calling Catherine Clark, who of course, was so close to him when they did the the sit-in together, and she stayed close to John. Most of us are in mourning at this point, and I think we're in a position that so many Americans are when you lose someone you love during COVID and you can't go through the process of recognizing. He was a gentle giant, just a tower of a person, 5'9", the biggest person I ever knew in my lifetime. I had the chance to travel with him 2019 down to Selma and Montgomery. He went every spring and took members of Congress, and I have a video that we've posted and was on television up here over the weekend of just him telling his extraordinary life story. And so however we're able to do it, we need to do something. I think people are really hurting in terms of he was the conscience of the Congress, and he will be lost. And, you know, this comes on the heels of Elijah Cumming dying within the past year. And there's some real extraordinary colleagues that I have the opportunity to work with, but John Lewis towered above them all.
I agree. Well said. Sean, do we have any questions from any of the listeners?
Yes, we do. We have a question coming in. It's I'll just read it here. Individuals with Alzheimer's or other dementia in LTC facilities are particularly susceptible to COVID-19 due to their typical age, their significantly increased likelihood of coexisting chronic conditions, and the community nature of the settings they live in. We remain very concerned about the pandemic's impact on this population and have been advocating for 4 key priorities around testing, reporting, surge activation, and ensuring adequate PPE. How do you see Congress addressing the continued crisis of COVID outbreaks in long-term care facilities in this 5th package or in the future? And thank you for all of your hard work on this issue.
Well, the person asking the question may or may not know that this one hits very, very close to home. I'm sitting here with a picture of my mother looking over my shoulder every day, but she died after 5 years experiencing Alzheimer's. And sadly to say, I'm glad she didn't live through this, because I can't imagine the multiple facets to how challenging this is. First of all, dealing with people who don't understand. I wouldn't even have begun to explain any of this to her. But second of all, the families, the fact that the families can't be with their loved ones in long-term care. So here in New Hampshire, this is one of the greatest tragedies we had. 8 out of 10 deaths happened in long-term care. And someday we'll try to look back and see what went wrong. PPE was a big part of it. I remember I'm haunted by the phone calls we had with the governor in March and April trying to get PPE to our long-term care facilities. So, I mean, the bottom line is we have funding. We had funding in CARES. We have funding in the HEROES Act, and we will continue to have funding going forward. This is a priority for all of us. Rosa DeLauro from New England's been a big proponent of, and John Larson about seniors. And what does it say about a society that can't protect our elders? It's tragic. And we've got to support the long-term care facilities. I will say, like other things, COVID has lifted the curtain, and there were long-term care facilities that had historically violations of policy to protect people, even during flu season, hygiene issues. And those were all exposed, because I know of long-term care facilities in New Hampshire with 0 deaths. My sister is in her early 70s, had just moved into a retirement community. They tested 200 people last month. They had 0 cases. So I know that there are congregate housing facilities of older people that have done very, very well, but there were far too many that just, it was tragic results.
Great, and there's one more question we have from, actually two more questions, my apologies. You touched on this just briefly already just now, Congresswoman, but PPE shortages continue to be a challenge for healthcare workers, including dentists, and even for teachers and other folks as well. We seem to have that initial spike, but we're hearing reports now of additional spikes and needs for PPE. Can you speak to a little bit what the federal government can do about the situation moving forward?
Yeah, leadership. I mean, I keep coming back to this leadership and a plan. It's called the Defense Production Act, and it is in place on the books precisely for this kind of situation. And they've been far too conservative or miserly in their approach. And they just keep saying, you know, the market will prevail. Well, look, I'm a huge fan of capitalism and it works great until it doesn't. But when it doesn't, people are dying and we need the federal government to step in. So, you know, thank you to the companies that switch their production over to make masks and gowns, and thank you to the individuals in New Hampshire. Frankly, it was people got on their sewing machines and made the masks and the gowns. And but leadership, I'm going to keep coming back to it. I am trying so hard, Jim, not to be political on this call. You have no idea, but I just have to say 105 days, everybody get out and vote.
Okay.
We have one last question.
Okay, good.
If we have time for it. The suicide rate has expectedly increased during the COVID-19 pandemic. We were delighted to hear that the FCC finally approved the use of 988 moving forward. However, we were disappointed to hear that the process will take 2 years to finalize. Can you care to explain or hypothesize why, what the need to take 2 years to implement this crucial mental health support mechanism and why it can't be expedited given the current situation?
Yeah, I think it should be expedited. We just had discussion of this in our hearing just the other day. We were passing the legislation about 988, and to have a suicide hotline that, you know, you don't have to remember whatever 12 digits in your jurisdiction, or I tell you, I served for 6 years on the Veterans Affairs Committee, and, you know, it's something like 22 suicides a day in our veteran community. These people served us. We need to serve them. We need to do a better job. Young people are distressed. So I hope that we can expedite that, and it's an excellent question. Yeah. Very important.
Well, I know we only had a limited amount of time for you, Congresswoman. I just want to thank you again for making yourself available. You know, you mentioned about the long-term facility area where we had an awful lot of neighbors and friends, you know, lost their lives there. You know, one area that I've always thought of that we may want to improve on is the personal care attendants that take care of these people.
Yes.
They make such minimum wage that many of them work at more than one long-term facility. And during this pandemic, that was a problem, I would think, that caused some of the unfortunate deaths, that we had people saying, well, she's not just working here, she's working at this may be a good one, but she's also working at another one because she's only making minimum wage, and that other one has a real high spike in the fatalities, and she's bringing it back here. So it's just an idea.
No, you're absolutely right, Jim, and it's part of a bigger issue around frontline workers. Right. Particularly, you know, frontline healthcare workers who are not appreciated and paid sufficient wages. And that's exactly what happened. And that's what led to the disproportionate impact in communities of color, because more people at that very low attendant level were going home. Maybe the housing was more crowded, maybe there were more people that they had contact with, and that was a big piece of this. And we've got to come to terms with that and pay people an adequate wage so that they can have one job and do it safely. And this is one of the things that COVID, I mean, years from now, people will be writing books and essays about it. We're not an island unto ourselves. We are all connected. And until everyone is fed and clothed and cared for, there's probably important religious principle here, but for me, it
Right.
just comes
Yeah.
from the heart. We're not
Right.
all safe until we're all safe.
Right. Well, with that, we want to thank you for giving us your time today, giving us an update on what you're working on, because those issues are so important to all of us. And it's called leadership. And you obviously,
Great to be with you.
obviously you espouse leadership day in and day out. And we're fortunate to have you as member of the delegation. And I look forward to seeing you in person, hopefully sooner rather than later. So thank you for all
Can't
you do.
wait. Thank
All right,
you.
thank
Stay safe. Wear your
All right,
mask.
thank you. All right, thank you, Congresswoman.
Take care. Bye-bye.
All right, thank you.